Hello, and welcome to the Holistic Nurse Academy, where we blend Eastern and Western medicine. Or what I say, we blend the science with the woo. Today, we have our guest, Jhill Seraphina, who is a licensed massage therapist and a Reiki master. Hi, Jhill.
Hello, I'm so happy to be here. Thanks for inviting me today.
Yes, thanks for being here. Um, I'm so excited to talk about sound healing and how we can integrate this into practice as healthcare professionals and nurses. But before we do, I just want to read a little bit more about you. So, like I said, Jhill is a licensed massage therapist, Reiki master, breathwork practitioner, shaman, and certified sound healer. She is passionate about all three pillars of healing: mind, body, and spirit. So whether she's providing individualized care in her office, teaching workshops, or doing sound baths at festivals, retreats, and conferences, Jhill makes everyone feel brighter, lighter, and happier. And I can attest to that.
I love that.
You do. You make everything lighter, brighter, and happier.
Yo.
Um, so let's just dive in and tell us a little bit about you. What got you into? I mean, you started out as a. Did you start out as a licensed massage therapist and then
Correct. Yeah.
got into counting? Okay, so tell us a
Yeah.
little bit about.
Yes, a little bit about my resume. I've been doing massage for about 18 years now, and I at this point in my career I had been doing it for 10. And I have been so passionate about massage therapy ever since a little child. My mom said I would set my Barbies up to be like doing massages. Like, I earned
That's
my
cute.
allowance money by massaging my mom's feet. Like, massage has always been my career path. There's never been a question, there's been nothing else. And so after high school, I just did all my things. And then finally, it was time to like do the massage therapy. And I got into it, fell in love with the human body, with anatomy, like the science, the body systems. My passion is the human body and like how it heals. Because I truly feel that healing occurs in layers, and like each layer can kind of need different things. And so I just became a student also of just the body and so many things. And so I love collecting tools for my toolbox. And yeah, so 10 years in, I felt very called to go get certified in an energetic modality called Reiki. And I was
Hmm.
confused by that call. It was very specific and it was very strong. So I'm like, okay, I'm going to go do it. I had never had a Reiki session. I literally I knew nothing. I just knew I was supposed to do it. So
Yeah.
I did a little bit of research of like who to get trained from, and I show up to class and I literally left in tears because the teacher was just assuming everybody was as intuitive as she was, and she kept talking about your spiritual eyes, and I'm like, what are those? Like, I'm so used to the science and anatomy and like the tactile touch of massage that it was so
Yeah.
confusing to then incorporate some energy work and start to understand the subtle like energy bodies and stuff like that. And I was just so confused, but her advice was to trust the process. So I did. And I was still kind of stumbling and fumbling along my way. And then, like a year or two later, I found sound. And I was at a yoga studio. And at the end, when we were all just laying there in Savasana, the teacher walked around just playing one singular bowl. And it pierced my soul unlike
Mm-hmm.
anything I had ever felt. I literally shot straight up and I was like, what is that? How do I do it? It was like literally everything I needed, and I just didn't know. Like, I didn't know what I didn't know like, until I was exposed to those healing vibrations, and it was everything my body was wanting and needing. And so I just purchased a bowl and I just started doing some self research. I ended up finding a place to get certified in. I learned sound healing and I loved it because it was like my missing piece of my triangle. Because, like, I had the science and the anatomy and the tactile touch of massage, and then the hands off approach to the energy work. And just like yeah, and that was just so different. But then sound was like the top of the triangle, and it truly covers both sides of the spectrum. It is
Yeah.
science, it is like physical, it is sound waves, it is like vibrations and frequencies and hertz and like all the science and actualness of it. But then also there is intention that is involved with it. And just like a harmonious, like, I don't know, I just loved it that it was like my missing piece to really truly work with the body and its healing and its spiritual body and the emotional body and just like all the physical body and just all the things. sound, my life took off and I am so passionate. I eventually started teaching sound and I've been teaching it for about 5 years now. And I'm just obsessed. And I love, one of my favorite things is to talk with professionals and teach them how to incorporate sound healing into what they're already doing. You don't need to like quit your day jobs or anything and become this professional sound bath, sound healer. No. I want to take the professionals who are already doing something and then teach them how to incorporate healing sound waves to enhance and magnify and supplement and just all the things to what they're already doing.
Yeah, I love it. I remember, I think as a human race, we all really love music. I don't know anyone who doesn't love some genre of music, right? And just as I've done my own practice, like through cranial psychotherapy, and I too took Reiki classes, and in what I do, and when I was studying to become a board certified holistic nurse, I was like reading the manual from the certification, process, and the manual talked about how our body has a rhythm, and how our bodies are, have a flow, and our heartbeats have a sound, and our lung breath, and when we breathe, that has a sound. And I was just like, oh, like it just really, that's why um having sound near us or using sound to heal works, because we are resonant beings.
Yes.
That is science. Like
Yes.
that's not.
Yes.
And so that was really neat. And as I use it in my own sessions, I'm very, like you said, very intentional about what I use, why I use it, as part of the whole, 3D picture of what I'm providing. So I love that. So let's talk a little bit more about, you've touched upon it, and I said a little bit, but like, what is the kind of science behind the nervous system aspect of sound healing,
Yeah.
and how can we talk about it in a way that feels grounded to healthcare professionals?
Yeah, sure. So there's two scientific terms that I love to teach about how and why our bodies are so receptive to sound healing. And those two words are entrainment and sympathetic resonance. So
Okay.
entrainment is when two objects that are in motion, when they get exposed to each other, they eventually they kind of like sync up with each other. So
Yeah.
this is found in a flock of geese. Nature loves the least resistance, right? It will always choose that easiest path. And so that's why like the geese flock together. Also with females and their cycles. It's literally a vibrational, it's a frequency thing. They'll sync into each other and they'll just start going with each other, right? Nature loves to just find that easiest path. And so entrainment is when two objects are in motion in different ways and then they become synced up with each other. The second term is sympathetic resonance. And that is where there's two objects, but one is in motion and one is not in motion. And it will become in motion because it's exposed to something similar. So the example that I use for that is like in my office, my laugh is like the perfect pitch and resonance to activate my gong that I have. And so like, I know, so sometimes like we'll just like laugh and like my gong will start singing, or I love to drum over my clients and I have some chimes hanging from the ceiling and they'll start to sing because of my drum, and so another example that's more common is the opera singer. When she can hit that high C, what's happening is she's resonating the tiny little particles inside the glass and they're shaking. And since it's such a rigid object, it ends up shattering because it can't handle the shakingness of it, but it's sympathetic resonance. So when two objects, one's not in motion, one is, and they both become in motion because of the exposure. So with that being said, what happens is our body, like you already said, we are vibrational beings because we have those rhythms. We have the heartbeat. We have the digestional system. Everything has a vibration. Therefore, it has a frequency. And these frequencies can be manipulated for good or for bad. And so that's why I'm so passionate about always like supplementing like on purpose and intentionally adding positive vibrations. But like if we're experiencing sickness or disease or just there's so many like pain, I just see as like a congestion or like, and so we're able to use things like tuning forks to put onto a muscle to encourage the releasing of that. And so we're getting pain management for multiple reasons just by exposing a patient to sound healings. Like you can use a metal bowl, there's crystal bowls. And in the class that I'll be offering, I'll be teaching how to do crystal bowls, metal bowls, tuning forks, drums, and chimes.
Okay, awesome.
Yeah, so
That's so
many.
so kind of talking about the parasympathetic nervous system, then we hear a lot about the vagus nerve, right?
Yes, 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 yes.
That gets a lot of buzz right now. But just in general, how does it calm the body?
Great question. So what happens? So with the brain, I always start with the brainwave state. We have 5 brainwave states. We've got the gamma, what is it? Beta, alpha, theta, and then the delta. So we like problem solving, active problem solving. Like when you're really stressed out at work, you're here. If you're just at work on like a good day, you're going to be here. You're awake, you're active problem solving. Alpha is when you're like sitting on the couch scrolling social media or like watching TV. You're awake and alert, but you're not actively problem solving. You're in like a relaxed state. But then theta, this is where sound healing, we on purpose bring our patients and clients down into we slow, because once we slow, like the heart rate, the breathing, and all of this all starts to slow together, like our brainwave states start to lower. And it's in here, it's like kind of here-ish, that the parasympathetic nervous system kicks in. So we are coming out of that fight or flight and we're dropping into that rest and digest, which I love because sound healing is a holistic modality. There's no pharmaceuticals needed. I just love it because like we are literally just giving our bodies that time and space to do what it already innately knows what to do. We're just kind of prepping the situation, right? We're just kind of giving that body like, hey, drop here. And then it's like, oh, okay, now I'm here. I can start to fix the things.
Yeah,
Yeah,
I love that.
it's so
Okay,
huge.
perfect. I love that. Thank you for sharing that. So you had talked about that you use it as a tool in with other tools. So how does it compare to other tools like touch therapy, breath work, meditation?
Yeah,
So,
so
or,
with breathwork, I am also a certified breathwork practitioner, and it's an amazing, amazing tool, but it does require your client or patient to do the work themselves. And so if we're in a healthcare situation, we may have a patient who is incapable of doing something like that, or even just grasping the concepts of like how to like breathe on purpose and like have there's different types of breaths we can do for different things. But I love the sound healing because we as healthcare professionals get to put it on and like we get to treat others with it and we can do like I said, prep their body to get into that state, to activate that healing state. And so, yeah, I love it because not everyone, it just depends on like your patient or client, like if they're able to do the breath work or not. So that's why I love tuning forks are my favorite. And I just love because I can just so easily just set it on and like it's quiet. I have activated it and you can't hear it. And so like in an office setting, in a hospital setting, like any type of setting, it's just quiet and so amazing and effective. And then also with like talk therapy, once again, that requires talking. And so either people don't want to be vulnerable, they don't want to tell the truth for safety reasons. Maybe they're just incapacitated and can't talk. And so I just love that words aren't needed to do sound healing. It like you can just put a tuning fork on someone. I love to do the sternum because bone is an amazing conductor, right? And so the sternum is always the first place I go because that way it's going to hit my heart and just kind of travel and just hit my nervous system and just travel for my whole body. And so I always joke that this is better than talk therapy because you can like pull up emotions, you can heal, you can do so many things, but no words are needed.
yeah,
I love
I
that.
love that. Yeah. As you're talking, my mind is going to different scenarios like that I've been in or other healthcare providers and nurses are going to be in where you're at bedside, you're in a home, or, you and I have our own room,
Right.
which is super nice because we can enter in whatever modality and it fits. Um, But I remember as a nurse, even just like a playlist, like I created a playlist that was really calming and soothing.
Yes.
I even felt silly at first being like, I have this music I want to play.
No, it's so fair.
And so I kind of want to talk about like how we can introduce it to people in a setting like that where it's not, taboo or weird or, you're the weird one. But every time I've done it is the thing. Here's the thing. Every time I've done it, it's enhanced the experience. Like the
Yeah.
patients really appreciate it. What I learned is you create the mood. You just, you take the authoritative, I guess, stand and say, you know what I think will really help? Some music.
Yeah. No, it's
So
so
anyway,
fair.
let's talk about that.
Yeah, no. So music, like I think nobody would deny that music has an effect on your mood. Because if you're stressed out and you're like someone's playing like a heavy rock metal, your anxiety is just going to increase.
Right.
Also, just think about like when we're driving at night, we turn down the music so we can see better. Like,
All right.
it's just proof that music truly affects our physiology. And so, having a relaxing music, once again, can just help calm the nervous system and just kind of activate the vagus nerve. Like, it does help calm. But there is a difference of just listening to music versus actually adding vibrations to your body. And I equate it to listening to a CD or like an album. I feel like that just dated me. I said CD. Okay.
I listen to CDs.
So listening to music like in your home, in your office versus being at a concert. We love being at a concert because your whole body is just filling with the vibrations of that music. And so
Yeah.
there's a big difference. Just like if you've ever listened to a sound bath like on YouTube versus being in a sound bath, the difference is feeling the vibrations in your body. Big difference. Music, yes, absolutely affects you. And so we do need to pay attention to like not just like the beats and stuff, but even the words. Like it makes such a difference. But also, if we wanted to get into most Western music, all modern music is tuned to the frequency of 440, whereas healing instruments are tuned to 432 hertz. So there is that 8 hertz difference that can make the like more healing be encouraged with an actual healing tool versus just listening to music.
Yeah. No, I love that.
Yeah, 432 hertz is considered the nature, it's the natural, it's the healing, it's like the frequency of the earth is what people say. And so that's why the healing tools come in. And one more thing I just wanted to add when you were comparing like other healing tools to like a sound healing tool, what I love, especially with the tuning forks, is that they are durable and portable. So you really can't just keep it in your purse. You can keep it in your work bag. I keep one in my car. I keep one in my computer bag. I keep one on my bedside table, and then I have lots in my office. So like I am always around a tuning fork. And like I'm obsessed with them because they're durable. Like I have bowls, but like they're not portable, they're not durable, and they break if you look at them wrong. And so healing, so amazing, so magical, but I just love the portable and like the durability, therefore the constant usage that a tuning fork can provide. I easily get overly stimulated in retail shops. And so that's the reason why I started keeping one in my car. There was an example, I was Christmas shopping and TJ Maxx just set me off. I don't know. It was like the music, it was the lights, it was the people, it was just the dirtiness. Like everything was disarrayed. And I literally just set my stuff down. I left the store. I didn't even purchase what I had in my hands because I got so overstimulated. My nervous system just was done. And I sat in my car, reached over, grabbed my tuning fork, and you just hit it on your hand right here. So nothing else is needed. I took 3 big deep breaths and I was able to calm my nervous system. And then I hit it again and I just started chanting Om, because then that added a vibration coming from within me. And I was like regulating myself to this frequency. And within 3 minutes, I was normal. And I just sat there with such gratitude because it used to take me hours, if not days, to re regulate my nervous system once I got overstimulated. And I'm like, what a game changer. Like, I didn't have to like wait for a pill to kick in. I didn't have to worry about any side effects. It was just this very simple tool, and I just did it. And in 2 to 3 minutes, you're normal again. Like, I don't know.
Yeah.
Like, it's just a game changer for me, and I'm just so happy, and I just love it so much.
I love that. So let's talk a little bit about who might not be a good candidate for it. A lot of times in the nursing world, we're talking about, and probably in the licensed massage therapy
Sure,
world, we're
sure, sure.
talking about contraindications.
Yes, we love that word.
We love that word. So what are the
Honestly,
contraindications?
I feel open wounds is an obvious answer just because we don't want to be sticking beings on or in open wounds. But I'm definitely a fan of like using a tuning fork like around a wound. That way we can encourage like healthy, just stimulate health, or what's the word I'm looking for? Healing.
Healing.
Like around it. Pacemakers, I think they say that just for liabilities. Let's not be putting thing like the vibe, because with that sympathetic resonance or like the entrainment, we
Mhm.
don't want to be affecting that because it's already doing a very important job. But then also with a pacemaker, I would not put like a tuning fork or a bowl or anything directly on their chest. But if they were to attend like a group sound bath or something, that's fine. That's not going to be as intense as putting it
Okay.
straight on them. And my answer will be the same for pregnant people, just because that little hot tub like that baby is sitting in, like the vibrations, because water is so conducive to vibrations, we just want to be careful with that. So I absolutely work on pregnant people all the time, but I just don't do anything directly on the stomach. And I'm also very careful, especially if I'm drumming. I don't drum directly over the stomach, but I think doing like the head or the legs, totally fine and so healing. And the mothers.
Mhm.
Yeah, so it's going to depend on closeness and intensity, but those are kind of the main things. I know in like my training courses, I always also advise like always work with doctors, like if there's any type of like active things going on. But for the most part, it's going to be healing and relaxing. So going back to the opera singer with the wine glass, that shatters because it's so rigid and there's no like bounce to it. I don't know, that's probably not the right word to use, but like our bodies do have flexibility, and so
Yeah.
nothing is going to break. So like your liver has its own frequency, but if I put something like a high frequency tuning fork on your liver, what's going to happen? So if the tuning fork has a frequency of here and your liver just comes online and it's at its capacity right here, it'll just come to where it is and then it'll stop. It's not going to explode, right? Like so that's also why I love sound healing, because it's like you're not going to cause harm, with the
Yeah.
caveat of, and I'll teach this in my class, of dissonant chords. And that's going to come in more with the bowls. Because if you play two notes that are next to each other, that's called a dissonant chord. And that I do use it on purpose. And so that's what I try to teach my students. Like, know the difference of playing something ignorantly and wrong versus like doing something on purpose to get a desired result. So when a dissonant chord is played, we can be pulling up like a trapped trauma or like emotion that has been stuck. But if we're just kind of ignorantly playing it wrong, it can actually cause your nervous system to like kind of get off. And I have seen that happen before. So I will go over that in my class, and that's very specific to the singing bowls. But other than that,
Okay.
you can't cause harm. And so
Yeah. Well, then this is what I love about a lot of what we're talking about. They're do no harm modalities, right? Um,
yes.
and that makes, we're always worried about liability and, um,
Yeah.
all of that. So, there's so many things
I know there
to
really
cover.
is.
I'm like, okay, brain focus. So one of the things, as a nurse, that might be a barrier, like I said, is being comfortable introducing the topic. So I just want to cover that real quick. So
Okay.
something I do is I always ask the client first, get permission, especially if you're in a hospital setting
Yeah.
or whatever setting you're
Yeah.
in. But really, if like you're in a hospital setting, or a home health hospice setting, you want to get permission, and then you just want to do it with confidence.
Yes.
And So I don't know, with our documentation, I always laugh because we have this whole section of documentation that like no one uses because we don't know what it is. Like,
Okay.
like for pain management, did you do guided imagery? Did you, you know, do therapeutic sound? Or there's like this whole section that I envision us bringing in and saying, now I have this section I can chart in, like non-pharmacological interventions that can help with pain, anxiety,
Yes.
you know, emotions. So you talked about the emotional stuff coming up. Um, so what else in that vein do you think of when I'm saying those things? Does anything pop up?
Honestly, what I was thinking about when you were talking is just the benefit of being able to amplify and do everything, like you just said, like from the healthcare perspective to the client or the patient, but
Hmm.
also just the benefits of the nurses and the healthcare providers using it on themselves.
Thank you
Like
for saying.
it is huge. Like just imagine how much like better like your bedside presence can be if you're grounded. Or
Yeah.
like if you're doing like a really long shift or you've had some emotional situations within your shift, it just going into the bathroom and just like I did in my car after TJ Maxx, just taking a few breaths and just regulating yourself to keep your mind calm, your nervous system calm, and you'll then be your best self for the situation at hand.
Yes.
Yes. Because
Amen.
sound healing, like there's honestly like so many studies and things out there, but like 'cause honestly it is science, like we've already covered. But like it does improve rest, it does improve healing, it does improve sleep. And like I feel like healthcare professionals need that too. Because I know like with long hours, like we have body aches as well, so like it's great for pain management, it's great for staying grounded, staying present. And so like using it on
Right.
yourself and other people, it's it's priceless.
Well,
Just amazing.
and that I think when you do these things and you try it out and you experiment with it, that's what gains confidence, right?
Agreed. Yeah.
So try it on yourself. The work always starts with us first,
Yes.
and then bring it into your practice, so that you're coming at it from an angle of experience, not just I've heard this is
Yes.
cool. I
Yes.
heard this work.
Yes. And honestly, everyone loves it. And just like my very first experience where I literally just shot up from laying down on the ground, I was like, what is that? It was so amazing. Most people have that reaction. The times you just kind of want to be aware of is if someone's extremely autistic, it can
Okay.
go both ways. Or like Down syndrome, I have seen just any type of, I don't know, just pay attention because it can go both ways. They'll either love it or they will hate it.
Yeah.
So like
Well, that's why I'm a
they honestly don't know also until you expose them to it. And so
right.
you just kind of do it and just see how they react. Same with babies. But like babies usually love it, but they just reach a point of saturation a lot faster than like an adult. So if I am using a tuning fork on a baby, I just watch for them to kind of squirm, like, okay, they're done. Like just
Mhm.
so gentle and just get same with like cats, animals, like I don't know.
Yeah.
Cats are the best because like I can be playing a bowl and they'll just like peek their head and they're like, "What's this?" And then they'll just kind of come and then they'll lay down by it. But if I try to go like put the sound healing on the cat, they're like, "Oh no." I don't know. It's just funny. Sometimes there are also just like people who they find the sound irksome. And
Yeah.
I go two ways with that. Either they have some healing that is needed, and so it's kind of bringing that up and that's making them uncomfortable, or they just straight up don't like it, and that's fine. And I always equate it to penicillin. It is 99% healing to the population, but there's that 1% that's allergic to it. So it's like, we will
Yeah.
allow it. Like, it's fine.
That's right. That's the buffet that we're giving people, right? Like as
Yes,
we learn these
yes,
different modalities and tools,
yes.
we have a buffet.
Yes. And just
That's
like I said,
that's
different layers of healing might require something different. So like just
right.
try different things. But yeah, like you were saying, always do it on yourself first so you can get familiar with it and just kind of find those spots that do just feel extra good. And like I'll go over in my class on some very specific spots that are generally amazing for the tuning fork to go on. And one of them is on the foot. It's like if this is your toes and this is like that ridge of bone right there and just right here, if you kind of bring it up and in, you can just see their entire body just like take a sigh. And like they just kind of sink into the bed just a little bit. Like it's amazing. So yeah, I
Yeah.
will go over specific spots on the body to do that with.
Yeah. So do you know trauma, like, do we talk about trauma-based healing in your class? Will we learn about that, or do we
I
want to
can
cover that?
go over that, but it's going to be so like it just varies so much. But like my usually just like indication is just pay attention. If their breathing starts to increase, then obviously something's happening like within them. So just you just always want to be so in tune and paying attention. But also, like we said in the beginning, how sound healing has that science aspect, but it also has that like emotional, intentional aspect. And for me,
Yeah.
my intention every time I am working with a client is just healing. And so I am just like, I use the words like healing, 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 or like release, 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 or even coherence is huge for the body, right? And so I almost like I see the vibrations as the carrier of my intention into their body. And I
Okay.
have just seen straight up muscles that are like this. And I will just say release, 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 and just put a tuning fork on it. And then it does this. I'm like, it's just amazing. Like,
Okay.
so
I love that.
so even with trauma, I have pulled somebody straight up out of a actual panic attack just through breath, and I put the tuning fork on her feet. So I was kind of grabbing her ankles. She didn't know how to breathe. I was telling her, breathe through your stomach because her chest was just breathing like this. And I was like, oh, honey, you need to breathe from your stomach. She's like, I don't know how. She was so disconnected from her body. She didn't know how to breathe with her diaphragm first. And so
Okay.
it was just this whole scenario. We just bypassed the massage and I was in like triage mode, just like bringing her out. And so with breath and like somatic touching and the tuning fork, we were able to regulate her. And she reported back that she slept that night for the first time in like a week or something. Like she actually was able to get actual sleep. And so to me, like that's just huge. But where was I going with oh, one of the
The tra-
reasons, just bringing people back into their body. That's another
yeah.
big thing. Like if they're having something going on up here, that's where the trauma. Because like obviously we can do like the somatic type things. Where like where in your body are you feeling it, and you can just straight up put the tuning fork where they're feeling it. Help it like evolve. Help it like resolve, and just do whatever. But I am so passionate about helping people reconnect with their own bodies and listening to their own bodies. And so putting actual vibrations on them is just a really quick way to kind of like stop the brain loop and just immediately drop into the body.
Mm-hmm.
So powerful, so fast,
Yeah.
so easy. It's holistic. Like, I love.
And people are wanting that more and more, aren't they?
Yes, 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 yes.
So do you have any recent stories? You just shared one, but do you have any other recent stories that really, if like you just had like kind of a wow moment with sound healing?
I
I know that's putting you on the spot.
know yourself. I'm just wondering, like, am I allowed to say? I don't know. In my experience,
Yes.
I had a mother. I do a lot of womb care and a lot of womb work. And I had a mother come in and her baby is breech. And she's like, I have an appointment in 2 days to like have the doctors like try to flip it. I was like, okay, do you mind if I just like do my thing? She's like, yeah, sure, whatever. And so I used my drum. And like I just said, we don't drum over the baby, but I was drumming like above it and below it and just kind of talking to it, just giving that intention. And then I was also using my finger like at the bottom of the mom's stomach just to say like, hey, we need your head here. Because they don't really, to me, the babies don't really know what's up or down. Like they're just in this little very tight hot tub, right? And so I was just using my vibrations to like be talking to the baby. And she reported that like it was like 3 hours, I think, after the massage, it flipped. And so she was so stoked.
Love
That she
it.
didn't have to have like medical intervention. We were just able to use the vibrations and intention, and the baby flipped. So I know.
Yeah.
Okay, love.
I've had cool experiences like that in my own modality, and it works.
It does.
Like it works.
There's a formula. Dr. Jonathan Goldman, he says vibrations plus intention equals healing.
Yeah.
And I just love. There's a quote by Rudolf Steiner that talks about how, like, when a piano gets out of tune, that we don't just start ripping out the chords, we tune it. Like, we just take the time to listen to it, find exactly which string is out of tune, do what we need to do to tighten it, loosen it, and just bring it back online. And then, like, the piano plays again. And I truly see our bodies as an orchestra. And so, like, if the liver is off, if the digestive tract is off, if the heart is off, the lungs, the orchestra's not going to perform, right, as it could and or should. And so we just need to use vibrations, listen to our body, and we can just so easily tune everything back up to where it's supposed to be. And it's just so.
And we don't have to throw it out.
No, we don't have to clip things out. No. Let's keep body
I
parts.
think
where they are.
I saw a med alert bracelet that somebody is like, just throw me in the trash or something. Made me laugh.
Oh my gosh, I love that.
But we don't have to. We've got all these other tools.
Yes.
Um,
And I think
okay,
that's also
so
just like what I'm sure like healthcare professionals fully understand this, but like what is it, like an ounce of prevention is worth like a pound of cure. So like if we can be doing small little things every day, that is going to be great to make small minor like course corrections within our body, versus if we're already in like an emergency situation, that's when it's harder to use holistic modalities. It's like that's when we're going to need the hospital. That is when we're going to need the doctors and the nurses to like come in and do the things. But if we can be at home doing the smaller things, I just think we're going to be so much better off in the long run.
yeah. Prevent, right?
And like there's a time for like that Eastern and the Western, like there is a time and place, but like surgeries like is not always the answer. Like
Yeah.
But sometimes it is.
Yeah.
Like I'm not going to throw an essential oil on a broken heart. Like,
right.
Yeah.
Good.
If I'm in a car crash, take me to a hospital. Don't put it to me. Like,
right. Totally.
Yeah.
So, do you have a little protocol or something that we could do real quick that I know you showed us some things, but is there like a at bedside or on ourselves that would be like 5 minutes or less protocol we could do?
Honestly, humming is a fantastic tool for vibrations because it's always with you. You don't need something extra or external. And it's so powerful. And once again, it only takes 2 to 3 minutes to activate that vagus nerve. So honestly, if we all just want to like take a breath, I love putting one hand on my heart and one hand like on my diaphragm.
Okay.
Just take a few big deep breaths, like in through the belly and then the lungs, and then we exhale as one. So it's like 1, 2, and then exhale for on the 3. And you can either hum, like do the HM, and then that vibration just kind of sticks up here. Or you can do Om, so like OM. And I love the O because you're going to kind of widen your throat a little bit. And then you can play with the vibrations because as you widen or constrict your throat, you will feel the vibrations come up or down like in your body. It's really fun. And the more you play with it. And then, so the O has like a wide throat basis to it. And then the is when we bring it back up here. And so it just kind of vibrates and activates like your third eye and just really awakens you and calms you at the same time.
Yeah.
So let's do 3 ohms. And it's not necessarily anything about the pitch. It's just about the vibrations in your body. So you can do it out loud. I'm going to do it out loud. We might clash. It's fine.
Okay. I was going to say, do you want me to mute so we can just hear?
Yeah. Okay, let's do that. You can go on mute. Okay. So let's go ahead and inhale to begin. That was so simple. It was just 3 little ohms, and I am hot. Like it got, like, I can just tell it physiologically like made some changes because like now I want to take off like my jacket. But it's so powerful and it's so easy.
Yeah, I love that. That's great. I'm also thinking, I've created a meditation class that I haven't put up on the website yet, but I'm going to. And it covers some of these similar like topics. And so these things would blend really well
Yeah.
together.
It is
So,
nice if you have like I'll do it with my gong if I'm doing like a big group thing. Sometimes I've done it with just a bowl. And if you can just make a note or a tone for your patient to match with, that makes them feel more comfortable if you're having them
okay.
do it. And or like with yourself. Took me a second to find it, but we did.
Hey,
Yeah.
I'm impressed.
So if you can just kind of give a note, that kind of helps mask, especially if you're doing it in like a group setting. My gong is really nice because it's loud and it's lower. This was third
Yeah.
eye, so that was A. So it was definitely higher than I was used to doing my ohms. But
Right.
the
Well, that's what I
concept
was
is
going to
there.
say is all of it feels super, if you've never done it, it's just like
Yep.
doing it out loud can
Yes.
feel really silly or uncomfortable. And it's just like, just do it and you'll see. And we can make fun of ourselves and we can have fun while we're
Yes.
doing it, right?
Yes. 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 Yes.
Don't take it too seriously, people.
I know.
Okay. Is there anything else that
Um.
you would want to add to that repertoire? I don't want to steal away from what you're going to teach us. So,
Yeah. No. I think I'll just go into the more details like in the class, and I think I
okay.
covered everything.
Okay.
Yeah.
That you wanted to cover?
Yes.
Well, I personally am excited to take your class. I have my own set of sound bowls that are chakra based, and I know the chakras really well, so I felt like I could do something with those. But I don't have the certificate in sound healing or anything like that. And music hasn't been like, I love music, but it hasn't been something I've studied per se. So I'm super excited myself to be able to learn from you and uh, all your wisdom. You can tell that you've dedicated a lot of time and energy to your modalities and what you do and your intention. So thank you for providing for us this education that we're going to have. Where can people find you if they're interested in learning more about you?
Yeah.
And what you do?
Vibes of Light is my Instagram. I think it's vibes.of.light because you can't have spaces. And then on Facebook, I'm just Jhill Seraphina. So it's Jhill Seraphina. And I'm the most active either on like my personal Facebook or my business Instagram. So
Perfect.
I open those up to everyone.
Okay. Well, like we said, Jill will have her class, in the next little bit. We'll have that uploaded, if not simultaneously with this recording. And if you want to learn more, go to the holisticnurseacademy.org and we'll have her information up on there. And for now, we thank you for joining us and we'll talk to you next time.
Yay, thank you.